Welcome to the QuickPlaceV biliary plastic stent in service. Today we'll review the proper setup and deployment of the QuickPlaceV plastic stents using the QuickPlaceV stent introducer. This is an educational program designed to assist in the proper use of QuickPlaceV stents and the QuickPlaceV stent introducer. It is not designed to replace the information in the instructions for use or IFU that accompanied the device when it was purchased. This presentation is a supplement to the information contained in the IFU. All the material in the IFU should be reviewed prior to operating this device. The QuickPlaceV plastic stent is packaged along with a protective sleeve which is used while passing the stent into the duodenoscope working channel. QuickPlaceV stents are made from ethylene vinyl acetate, or EVA, which give them a soft, flexible feel. The stents have anti-migration flaps on each end of the stent. A side hole is found on the tapered end of the stent, which helps maintain bile flow while the stent indwells in the bile duct. QuickPlaceV stents are available in 7, 8.5, 10, and 12 French diameters. They also come in straight, duodenal bend, center bend, and double pigtail shapes, and range in lengths between 5 and 18 centimeters. The double pigtail shape is available in the 7 French size only and ranges between 3 and 15 centimeters in length. The 10 French duodenal bend configuration is demonstrated in this video. The QuickPlaceV insertion kit is composed of an adjustable length guide catheter and pusher catheter. The tip of the guide catheter contains a radio-opaque marker to help guide stent placement. The catheter also features the V marking, which tells the endoscopist when the tip of the guide catheter has reached the forceps elevator on the duodenoscope. The handle features the C hook, which attaches to the boot of the duodenoscope handle, enabling physician control of stent deployment. And the end of the handle has a locking collar that enables the user to adjust the guide catheter length and lock it in place. Load the protective sleeve packaged with the stent over the guide catheter and pusher catheter. Then load the proximal end of the stent onto the guide catheter until it contacts the pusher catheter. The tapered end of the stent must be oriented to enter the bile duct first. Detach the guide catheter from the locking collar by turning the control knob counterclockwise. Then pull back until the desired length of guide catheter is extended from the stent. Turn the locking collar clockwise to fix the guide catheter in place. Backload the guide wire into the guide catheter and advance the guide catheter with stent into the duodenoscope biopsy valve. Stop before the second side flap reaches the biopsy valve. Slide the protective sleeve over the stent and partially insert it into the biopsy valve. Once the protective sleeve is in place, then resume passage of the stent and insertion kit into the duodenoscope working channel. The protective sleeve may be pulled back once the stent is completely past the biopsy valve and into the working channel. When the guide catheter reaches the elevator, lower the elevator and continue passing the guide catheter and stent along the guide wire into the bile duct. The length of guide catheter can be adjusted by turning the locking collar counterclockwise, and you may lengthen or shorten the guide catheter as needed. If shortening the guide catheter, be sure to watch for where the radio-opaque marker on the guide catheter is located to avoid premature stent deployment. Turn the locking collar clockwise to lock the guide catheter. Once the stent is in the desired position, release the guide catheter by turning the locking collar counterclockwise. Withdraw the guide catheter and then the guide wire until the stent is free. If you are placing more than one stent in the patient, then the stent introducer can be reset. Push the control knob until it makes contact with the locking collar and lock the guide catheter in place. Load and deploy the next stent in the same manner as we illustrated earlier.